I'd like to take a moment and talk about capsular contracture. What is capsular contracture? Well, the body doesn't really understand an implant, so effectively what it does is it walls it off in a rind of tissue. The rind of tissue generally stays nice and pliant and soft, but sometimes that rind can get firm. Somewhere around 10% of the time, the rind or capsule that forms around every implant can have or get some sort of firmness where perhaps it looks a little firm or feels somewhat firm. Around 3 or 4% of the time, that rind can get quite firm and be very hard. You'll hear people complaining about firm implants. Well, it's not their implants that are firm. What's firm is that capsule or rind, the breast implant itself. Well, what can you do about it? Well, the first thing you can do is you can take the implant out, you can take the capsule out and go back to your non-implant itself, and that rind or capsule will never come back. Most people don't like to do that because once they've had a larger breast, they don't tend to want a smaller breast, but that is a possibility, and sometimes people elect to do that. The other option is to take the implant out, take the capsule out, and put a fresh implant in. In that case, the numbers are the same, but you'll get another capsular contracture. That's to say around 10% to get a mild to moderate capsular contracture and around 3 or 4% to get a very hard capsular contracture. Additionally, there are special tissues called acellular dermal matrices, or ADM, that you can carpet the inside of the cavity with. The advantage of this is that in my experience that stops capsular contracture. There is an expense to this, and we don't generally start with that. That is to say, you usually don't use acellular dermal matrices on patients that are first getting a breast implant, but only those that have had repeated problems with capsular contracture.